WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases, and we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
Breaking news tonight, the coronavirus forcing millions more Americans into virtual lockdown. Over 75 million people in New York, California, Illinois, and Connecticut ordered to stay at home. The U.S. borders to Mexico and Canada set to close to non-essential travel. A spring break crackdown. Florida communities closing beaches. In Europe, the crisis growing inside the ICU in Italy, the country's deadliest day. Fear on the front lines. ER doctors saying we are on the verge of a medical disaster. Healthcare workers' lives at risk.
There's a lot of anxiety. There's a lot of fear. There's a lot of, wondering if you're risking your life by going to work.
Critical shortages of life-saving equipment. New developments on that $1 trillion relief plan. How soon Congress could approve those checks for you. The staggering rise in unemployment. People out of work lining up for free meals. The healthcare crush, vital treatments delayed. Our correspondent battling cancer, feeling the impact firsthand. The surge in students learning from home. Over 50 million taking lessons online. But what about the kids without internet access? And does the coronavirus present a bigger risk to pregnant women?
This is NBC Nightly News with Lester Holt.
Hello, my name is Brandon Lilly. I'm a commissioner with Maryland Commission on Disabilities. I'm a customer service worker at Giant Food. Also receive support from DDA in Maryland. Welcome to our COVID story. During the early months of the pandemic, state IDD leaders worked to ensure support systems could withstand the rapid changes taking place due to the public health emergency. Providers struggle to keep people safe and assure to change demands on our services. Direct support professionals, but bravery continue to work to provide support even during the most uncertain times. People with IDD were put on lockdown like the rest of the world, but advocates did have very different experiences of the lockdown than the rest of the world. Essential services change, sometimes support stop. Social networks, which are also important to many, not only for mental health, but also safety became isolated. Some people with IDD experience additional trauma related to solutions with their past. However, as a community, we rose above. Our COVID-19 story is a tribute to all people all people in the IDD community who found hope during this time. This is their story and our story. Our first story takes us to South Dakota to meet Derek Smith. He's support system and the IDD director, Joy Yu Ni. Derek is living the dream in South Dakota. Derek moved into a home of his own a few years ago. His home has a hot tub and a man cave. You could invite me anytime, Derek. Derek is a Special Olympian, business owner, and involved in his church. He receives support services and spent a lot of time with his family and friends. Derek had worked hard to make a life he was proud of. Then came March and his whole life changed. Let's talk to Derek and his mom about how shocking it was to have his world turned upside down, and how he used technology and tools to learn from IDD. Leaders in South Dakota put it back together. The real story of teamwork making the dream work.
Good afternoon, everyone. I'm Derek Smith, and I live in Sioux Falls, South Dakota. My mom, Brenda, here with me. So as you can see, this is my Smith family. This is a little more about me. This is a wide range about me.
Yes, there's a lot of activities that you're involved in. Could you mention a few?
Toastmasters, Bible study group leader, Celebrate and Embrace member, volunteer, assisted living, and nursing home.
Yeah, and you also are an advocate, an athlete. You work out at a gym, and you're a business owner and
Great Life member, fitness.
An employee.
Yes.
And what is today?
4-year anniversary.
Of when you started your job at Great Life, right?
Yep.
A lot going on.
Yeah. So as you may know, I live on my own home.
In your own townhome, right?
Yes.
Mm-hmm. And what are some of those pictures on that townhome?
This is a picture of my house.
Mm-hmm. And up in the corner?
Is my man cave gonna be,
Mm-hmm.
and my hot tub.
Yes, okay. And so tell us a little bit about this.
Okay, through our Family Support 360 program, I'm able to live in my own home. This is Linda, my support provider. Well, she helps me clean, cook, with groceries.
Shop for groceries and go out and about in your community, right?
Yes. So how many of you play a game called Jenga? Everybody knows that.
Yeah. And so as Derek said, my name is Brenda and I'm Derek's mom. We often use the analogy of the game Jenga when we talk about building Derek's life. Because we have worked very hard over the years to build a life that's meaningful, that includes the things that are important to Derek and the things that he needs in terms of support to be successful. And if you've played Jenga before, as you build the tower, it's stable, but it can be a little shaky. And if one of those pieces gets pulled out,
as you see here.
Yep, it can get a little more shaky or even collapse, right?
Yep.
Yep. But over the last year, we've had things in place and it's gone quite well.
And then now DD Council's on virtual.
That's right. And so what's happened?
How many of you are with COVID?
Are familiar with COVID? Everybody probably is. Because COVID happened, and then what happened?
It fell apart.
In one day, everything that we had put together seemed to just fall apart, right?
Yep, as you see, the Jenga likes to be falling apart.
That's right. And that kind of reflects what happened on that day.
So
So when that happened, and you couldn't go to work anymore, Linda couldn't come anymore, you couldn't go to the nursing home anymore and volunteer, how did you feel?
how many of you are confused, stressed? What's going on? Frustrated?
A little bit worried
Yeah, worried and depressed.
and a little bit depressed. And did you feel all of those things?
Yes.
Yeah, you did, didn't you? And at the same time you were feeling those things, I was thinking, oh my goodness, now what? We worked so hard to get your life kind of going in a routine, right?
Yes.
And everything kind of fell apart. So now what? So we kind of thought about, what do we know? We know,
Person-centered thinking.
yep, and we also know,
Charting the life course. How many of you like to do that?
yep. So we knew that we had to develop a new routine because that's important to you,
Yeah.
okay? And it needed to be based on what was important to you.
Yes.
So we just had conversations and we developed what?
A trajectory
Trajectory,
and so STAR. How many of you done that STAR?
yep, an integrated support star. And we thought, let's develop a vision of what the next few weeks looked like, but it's lasted longer,
Yeah.
hasn't it? Yep. And then while we felt like all of our resources had gone away, we started talking about them and realized that we do have a lot of supports and resources that we can access.
Right.
And so we use that information, and
The calendar, as you see, has a routine.
that's right. So you had a new routine based on all of those things that still matter,
Yeah.
right?
Yeah.
And you follow this calendar, don't you?
Yeah.
Mhm. So one of the things you learned was that you could still have,
A remote support.
yep, through family support, you were able to continue to work with,
Linda Powell.
yep, through remote support, right?
Yes.
And so what were some of the things you guys were able to come up with?
Connecting families and friends.
So you just use technology, right?
Yes.
To be able to stay connected to your family
And friends.
and friends. It's
Uh,
important to you.
Yes. So I do lead a Bible study group online.
Every Monday, right?
Yes, every Monday morning.
You used to meet in person, but since that wasn't possible,
We do it virtually now.
yep, and Linda's able to
Do
provide
support.
some of the supports to help you do that,
Yeah.
accomplish that.
How many of you like to hear of Dr. Karen Harvey?
Yep. And so what happens every single what?
Monday, we talk about what Dr. Karen Harvey.
Yep. And we do it on Facebook Live, right?
Yes.
Because we feel if you're experiencing some of that stress, don't know what to do, kind
There's
of feel
videos.
afraid.
There's videos for you can see.
Yep. So you do it on Facebook Live and share it with people.
And then I put it on YouTube as well.
Yep. So that you can help others
Yes.
cope through COVID
Yeah.
just like you are.
Yeah. So I was going to try and volunteer at the assisted living, but it closed down. But we had to do the, as you see here, dry erase board with a message on it.
And so we would take that over to the assisted living and you'd walk around the building so that you kept those relationships and connections up, right?
Yeah. Mhm.
And brought a little joy.
Yes. So I host a book club and Linda helps me with that. We do read almost a lot of books,
Yeah.
but
And how often do you meet?
2 times.
2 times a week via Zoom. You invited some friends
Yeah.
and have a book club.
Yes.
So you don't feel isolated.
Or alone.
Yeah. You get to connect with friends and have a good time.
Right. So, as you see, this is a game called bingo.
Yeah.
How many of you like to play a game called bingo?
Everybody likes to play bingo, right?
Yes.
And so Derek used to volunteer at the assisted living calling bingo. Since he couldn't do that anymore.
Like I did at the Ver Brady in Mitchell at the time.
Yes. And so since you couldn't call bingo in person, we decided you could do it online and invite a bunch of friends.
Yep. It doesn't have to be perfect with themes. Doesn't have to be
Yep. But sometimes you have themes, like this was a beach.
theme.
Yep. But it provides an opportunity to connect with friends and just have fun.
Yeah. So every Wednesday, like tomorrow, for example, how many of you like to do a music party
Yeah. So you started a music party on Facebook,
live?
and one of your friends,
Dan Kleberg,
he plays the guitar and sings, and people can join in
live from Aberdeen, South Dakota.
and they can sing along, dance in their kitchen, or just listen.
Or comment of where you're from and tell us what kind of songs Dan can play.
Yep. And have requests, right?
Yes.
So there are lots of things that you can still do, but it takes a little bit of support, doesn't it?
Yes.
Through,
Family support.
yep. You still do the remote support.
It's going to be all the time now.
Yep. You still do,
The
she has started to be able to provide some in-home support,
Yeah.
but we have to make sure that everybody's safe.
Yes.
And then you've visited with your doctor,
Dr. Jason. Yes.
yep, by telemedicine.
Yep.
And who else provides support to you?
Family.
Absolutely. And all of those things put together kind of make it possible to have life be as good as we can make it, right?
Right.
Okay. Yes. So with that,
I want to thank Carrie for our taping of the video, and I
thank them for watching.
and thank you for watching, and hope you watch again. And please wear your mask,
Keep your distance
wash your hands,
and stay safe, and
healthy.
bye everyone.
Bye, everybody.
We've been able to use a lot of Charting the Life course tools to redefine creative ways to support people to continue having really fulfilling lives during this uncertain time in the pandemic. We were fortunate because we were able to have our Appendix K approved through CMS, and so that allowed for different supports in different ways. And we were also able to leverage our executive order from our governor here in South Dakota, which really helped with creating new supports or different supports in new ways. We were able to leverage a lot of technology, increasing more virtual visits, telehealth visits, which has really ensured that people are having fulfilling lives even in a scary, uncertain time. So we're just starting some early review of lessons learned through the pandemic, and some of those things are continuing with virtual supports that we previously wouldn't have used to this extent. That includes telehealth and telemedicine, specifically counseling services to help meet some of those behavioral support needs that, normally we would have gone in for in-person visits. Telehealth is able to help to continue to meet that need in a new way. As far as communication regarding changes being made or just day-to-day changes, we're trying to communicate those really consistently. We're learning that there's some opportunities to be more concise and clear in that communication in such an overwhelming time. And so we're going to take advantage of that opportunity, but we're really focused on providing a timely, clear direction to our providers, as well as as individuals and families as far as how services have changed and will continue to change until we are through the pandemic. We are really working to be intentional with our communication with all stakeholders. We are doing that through brief check-ins on a weekly basis, as well as holding regular monthly meetings to ensure that that communication is very open and clear and consistent, as well as being two-way through the process. None of the supports and services could have continued through this time without the really exceptional work of all of our key partners and all of our frontline employees, direct support staff, service coordinators, case managers who have really helped to carry this work forward. And not to be forgotten, and certainly last but not least, is the great partnership and collaboration with people supported and their families through this time. There has been much flexibility and grace that maybe we hadn't leveraged in this way before. And certainly the ability for us all to be flexible at this time is what's ensuring we're coming up with creative ways for people to still have fulfilling lives. The state staff here in South Dakota are extremely committed to the work that we do every day. This has been a challenging time for everybody. That commitment has gone unwavered throughout all of this. I'm extremely proud of our team here in South Dakota and the work that they do every day, inside and out of the pandemic.
Our next stories take us to Pennsylvania, where we meet William Brewer. William began painting in the summer of 2015 after a college student minoring in art began working with him. The art student handed over some art supplies and asked William that he was interested in. William now sells his paintings and crafts. He makes quilts, tote bags, pillows, and jewelry. His work has been featured in the Philadelphia Artisan Project art show at Philadelphia City Hall. Sales of his art help supplement the income he receives working as a power coach for self-advocates united as one. He and other SAU 1 members travel through Pennsylvania to teach people with disabilities and their families to advocate for everyone's rights to have an everyday life. During the pandemic, William discovered the power of using online sales to boost his art business. With the support from Pennsylvania Office of Developmental Programs, William's services changed to meet his technology requirements and adapt that technology is assist someone with significant support needs. We will hear from William and the Director of IDD Services in Pennsylvania, Christian Ahrens, about finding opportunity even during the hardest times.
Before people got sick, I was going to Utility Works 3 days a week. I worked with 3 people, Aaron, Taylor and Jesse. I won Sardak on February 28. After people got sick, I could not go to Utility Works.
London and Wilbraham. and on this.
I had to stay home. I worked with Aaron on Zoom. We worked with Photoshop. I worked on Sardak. I talked with other fellows in Sardak. I have been power coach at Sal1 since 2008. On Thursday I would get on Sal1 calls. I would see Oscar, Mom, Christine, Sierra, Kay, and other people. Aaron would help me on the Zoom calls. It helped me making art. Now, I go to Utility Works 3 days a week. I have to wear a mask when I'm going out. I am teaching 3 workshops. The workshops are recorded on Facebook Live and Zoom. It helped me planning it when I had to stay home. Mom, Dad, and Aaron helped me when I had to stay home. I learned how to do Zoom calls and screen share by myself. Photoshop was fun to do on the computer. I did this with Aaron. I draw on MS Paint by myself. Seeing people on SAU1 calls helped. On June 23rd, I went back to Utility Works. I was so happy. I am painting and working on clay and firing in the kiln. September 9th, I started my workshops. I am teaching Nick, Alex, and Josh about art. I am excited to go to WAA and not wear a mask anymore.
An art studio for William would be important because it would allow him to continue to grow as an artist. He has many talents. He sews, he paints, and when he's home, he has limited space in order to do that. So being in a studio and being around other creative people would, I feel, inspire and spark him to do even more than he does now.
As we watched with horror the news coming out of the Life Care Center in Washington, listened to the epidemiologist as the pandemic unfolded in China and Europe, ODP, the Office of Developmental Programs here in Pennsylvania, began back in February to look at aggressive ways that we could protect people with intellectual disabilities and autism from COVID-19. So by March, we had added flexibilities through an emergency Appendix K into our waivers. One of those key areas, which I think you all heard in William's story, is that we added a number of services could be provided remotely. William is obviously someone who could benefit from those remotely provided services, and William took full advantage of that. I think watching William learning Photoshop, which you'll see in one of the video clips of William, really affirmed for me one of the approaches we took to remote, adding remote options for services. One of the things that we've said here in Pennsylvania is that not only do we want to make sure people are getting services remotely if that can meet their health and safety needs, if that can meet their social needs, but it also has to be aimed at skill building, at building skills for using the technology. One of the things that we've always been concerned about is this big technology gap for people with intellectual disabilities and autism. I think the pandemic has meant, out of urgency and necessity, that we have had to try to quickly close that gap in some ways, and we certainly don't want to lose that. So our service definitions include this requirement that some of when remote services are being provided, that we are working to help people be as independent as possible in using the actual technology so that they can connect with friends, so that they can use it to be learning new skills, so that they can connect with the world around them, so that they can receive services remotely. So I think that's a key component in William's story. It really helps to illustrate that. One of the things that I hope you've all gathered from his story, and you'll gather from the video, is that, as long as I've known William, he's been very comfortable with technology, cameras, smartphones, video equipment, and that served William very well during this pandemic. He was able to continue his art. He was able to build new skills as an artist through this. He was able, you heard him in his interview reference a number of friends. So some of those are self-advocates that are engaged in peer support work that is funded through our office. And it was really important to have that through a tough time. I had the opportunity to talk with William before this interview, and he shared how critical that was. You also could see, he's simply connecting with friends through technology. So just a really big part of our response, and something that we certainly intend to continue post-pandemic. Another thing that I think is critical here in this story that, again, might not be evident so far is how important self-direction and our self-directed model has been for so many people in this response. William has self-directed his service for years. Used a supports broker that helped in terms of planning for and coordinating some of the work he shared with his business. So, for William, I think that was an important piece of this, but for so many Pennsylvanians, self-directing services meant that they had the ability, where people were very concerned about outsiders coming into their home when we went to stay-at-home orders. We lifted some of the restrictions that we had on relatives providing services. So what we did see is, particularly in our self-directed program, we saw less of a drop-off in services than we did in some of our more traditional service models, because people were able to use relatives. They were able to use people that either lived in the home or they knew, were staying in their own homes and didn't really have any exposure. So that was really a critical component to our response here in Pennsylvania. Other thing William referenced that I'll make a note of here in our response. William talked about starting to, when we did the stay-at-home orders were lifted and people started to re-engage, William was able to go back to his art studio, and that of course required masking, and talked with William and his direct support provider. They took advantage of a number of the resources that the state developed. We worked with our autism services, education, research, and training contractor to develop graphics for graphic support and social stories around masking, around social distancing, and around hand washing. And it sounds like those materials were very helpful for William in learning some of the new skills that we all need to be successful during this pandemic. So I think three key areas there: the self-direction, the remote services, and then just having very accessible resources for people to build and use all of these new infection control protocols that we've all needed to get familiar with to get through this. We have a self-advocacy organization called Self Advocates United as One that we contract with, and we were contracting with prior to the pandemic. When the pandemic hit, we obviously, a lot of those trainings were face-to-face, and that wasn't going to continue. What we worked on with the self-advocate organization was to shift all of the training content to addressing the pandemic. So we asked for SAU1 to shift all of their topics to supporting self-advocates with navigating this new world that we all find ourselves in. They were actually doing weekly calls, peer-to-peer calls, where they would talk through everything from, the new requirements, what social distancing means, just combating the isolation. What do you, how are you taking care of yourself during this time period? So they did the weekly calls, and then they sort of quickly shifted to this concept, which I think is just great. One of the things that they did in their contract was called the Speak Up, kind of Power Up self-advocacy sessions, and they changed those to be called the Antivirus Power Up. Self-advocates became very concerned. The leadership of that organization became concerned that during the pandemic, people would sort of lose their voice as we moved to this big online world, and they committed to not losing that voice, and so did have this whole series of sessions called Antivirus, aimed at making sure that self-advocates don't lose any of that voice that they are online, that they're still advocating. So it's been a really wonderful thing for us here in Pennsylvania. The other area where I think the peer work has been critical in our response is we worked with self-advocates through Self-Advocates United as one to develop a roadmap for re-engagement. So post when our stay-at-home orders were lifted, and we started going through like a number of states, we had, red phase, yellow phase, green phase. As those orders lifted and there was more access to things in the community, worked with self-advocates to develop the roadmap for re-engagement. So, what did you used to do? What do you want to re-engage in? Are there new things that you tried during the pandemic that you want to continue? Where are your risks? Where do you need support in terms of learning about social distancing, learning about or being able to tolerate masks? How do we figure out a way that you can tolerate a mask? So it really goes through very step-by-step, all kind of domains in people's lives. And that was the work of self-advocates on that was essential for the success of it. So we have a very nice roadmap tool designed by self-advocates for self-advocates.
Our next stories take us to Ohio. Christine Brown is a strong disability advocate. She is a land self-advocate facility member and critical research assistant. She serves on the board of the Ohio Self-Administration Association and the Self-Advocate Advisory Council of Franklin County Board of DD. Christine is laser focused on what's happening in services and policy for people with intellectual and developmental disabilities. In March, Christine found herself working from home like many people across the world. But she did not let that stop her from speaking up and speaking out about issues that matter to people with IDD. Christine partnered with her co-workers of Nice Organ Center, along with leaders from across Ohio and the nation, to ensure people with IDD were included in the COVID response, and that people with IDD were given a chance to communicate with leaders and their experiences during the pandemic. Christine worked with Jeff Davis, a director of Ohio Department of Developmental Disabilities, to make sure advocates' voices were heard. Let's hear from Christine and Jeff.
I was first the self-advocate trainee in 2016 to 2017 in LEND, which stands for Leadership, Education, and Neurodevelopmental Disabilities. I am a clinical research assistant and self-advocate faculty. The changes that I experienced when I was in the COVID-19 pandemic that we still are in, hit by having reduced level of staffing, more remote support, and staying in the house, and less active because we can't go as many places as before. We wanted to make survey because the Ohio Department of Health was doing a COVID-19 survey for seeing how other Ohioans were doing it, dealing with the pandemic, but they didn't focus on the disability community. And we wanted to focus on the disability community, especially individuals with intellectual and developmental disabilities. And individuals with intellectual and developmental disabilities are often left out of research and not given the opportunity to answer questions for themselves. We know that we can learn so much by listening directly to our stakeholders. They are able to tell us how to know how the pandemic is affecting their personal lives better than someone else, because the individual is the one experiencing this. And we want to hear what everyone has to say and how could we make the services even better during this time. The partners who we sent out the notification for the survey included the Ohio Department of DD, Ohio Self-Determination Association, Franklin County Board of Developmental Disabilities, Ohio Association of County Boards of DD, AUCD, which stands for Association of University Centers of Excellence in Neurodevelopmental Disabilities, which the Ohio State University Niswonger Center is part of. We adapted and modified some questions from an existing survey called the Epidemic Pandemic Impacts Inventory from Dr. Damion, D-A-M-I-O-N, Grasso. Our team also worked with our partners to come up with questions across different areas, including disability services, healthcare, mental health, employment, and technology use. Our partners helped us distribute the survey link through email listservs and by posting it on social media. About 400 people completed the survey, including 181 individuals who reported having a job before COVID-19. Unfortunately, 50% of those employed before the pandemic were laid off. Alarmingly, 50% of all participants reported having more mental health problems since the pandemic, including being worried, 70%, stressed, 66%, and sad, 56% were the top three. Only 60% of participants reported knowing what to do if they were exposed to the virus. Health and public safety information needs to be made accessible in clear language and distributed through an extensive network with the help of partners, including state and local provider agencies and self-advocacy groups. I can also say that with this, we really have learned how people feel in their in how technology for internet access has been a hot topic during this pandemic, because when now everything is going virtual, in doing doctor's appointments virtually and doing a lot of other things virtually, even like your counseling or your seeing your psychiatrist if you just need refills and nobody needs to really see them physically. We also learned that there was some other people who live in an ICF, and that's an intermediate care facility. And when doing the doctor virtually, their anxiety levels and stuff goes down because they're not having to leave their house and going into out of their environment, like going to the hospital or somewhere. They get to do it virtually. But there's always a little bit of challenge where what if a family or individuals don't have internet coverage? What about those folks? They have to still do stuff physically. So that was a very big hot topic, internet coverage as a way for the way people with social distancing. Internet coverage is a hot topic right now. Well, the one thing to tell you is we're all in this together to fight and see that we get everyone's needs met. We want to see everyone have equal choice and rights to do things for what they want to do. And we have some concerns that there are chances that some individuals with intellectual and developmental disabilities are not getting the treatment for COVID-19 versus someone who has like insurance. And that's something we fight on to say that's not fair, because everyone is American citizen and deserves fair treatment.
So my assumption is our experience with COVID is similar to other states. It's been a journey in many ways, from a initial recognition and a sort of blanket stay at home, and people had to adjust that way, to one where people are more accustomed to living in a virus environment, but it brings with it its own challenges. And I think we're in that period now in Ohio, at least, where you can feel the exhaustion and the fatigue. And there have been so many remarkable stories with our DSPs and with our providers in collaboration with our counties. And sort of that ramp up led people to the energy that accompanied a fight. And now, over a prolonged period of time, you can feel the effects of just that extended battle with a virus of the nature that we have. And so we are feeling that fatigue and that exhaustion, and you have to continue to find ways to nurture and support, you hope, and the relationships help, which we'll talk about. But we're in that stage where it is just a recognition that this is ongoing, and that you have to be diligent, and you have to take advantage of all the strengths inherent in your system. And I'd want to say this up front. I'm sure everyone that listens to this has an advocate or advocates throughout their self-advocates, if we like, throughout their system that are just absolutely remarkable. And Christine Brown is one of those for us. She is absolutely tireless in her efforts on behalf of the individuals that we support. So that's a real advantage. And with that energy that Christine brings continually, sort of forces us to, hey, let's do this, let's do this. We have had a wonderful partnership with the Nice Honor Center. They're affiliated with Ohio State. As you said, but we've used them and worked with them, contracted with them in a number of different ways over the years. They were intimate with us on our efforts around remote supports and planning for the future. So we know them well, we're comfortable with them, and hopefully it's vice versa. We lean on one another. And I think that strength, has played itself out in this rather creative approach to talking to people during the virus and getting their experience. Obviously we will help where we can, and we've got talent in this department, and they were part of the effort in working with them and fashioning the questions and different things. But I don't by any stretch want to take the spotlight away from Christine and the Nice Honor Center, because they carried it out. And so what I would say, and I guess I don't know this, but it feels like it's a unique idea. And I think the personal nature, sort of that on the ground nature with Christine and her relationships with other self-advocates and also with the Nice Honor Center, allowed us to get a pretty good response to that survey. But it was just that I want to hear, from you. This is the way they did. Tell us how you're doing. Tell us how this virus environment, the virus and then the environment virus has created. Tell us how you're feeling. Tell us how you're doing. And so I think there are some really good things coming out of that. And some of them are striking. The piece about employment, I think we had a sense, but we had a number of individuals that were competitively employed. I think we were down to about 50% that lost their work. Some are coming back. We're watching that very closely. That's a good thing, but that's a harsh impact, like it is throughout the entire community, our entire communities everywhere. And then also the number, and this probably reinforces what all of us intuitively know over time, the environment itself, the anxiety that accompanies, the virus and all the changes that happen result in mental health issues. We know this. We know this for everyone, but it is for obviously those that we support as well. So we are seeing more anxiety, more sadness or depression, a number of things. So we have to be particularly careful around that and see what we can do again to just keep our finger on the pulse to the best that we can with our partners, our providers. We have county boards, developmental disabilities in Ohio. So it's our responsibility to do what we can with what we know, and assist people as we move into the continued phases of this environment until we're out. We try. I would give us and certainly our communications individuals. Stephen is listening in. I mean, just an A+ for the amount of information that they put up so much early on. I think we revised something along the lines of 30 administrative rules. I mean, it was just constant, and then guidelines, and people ask for them. But it's simpler to do that, isn't it, in among professional partners in your system. It's harder sometimes to get at, to the individuals themselves for one reason or another. So I would just say, and if others have magic answers, I think you're always working at that. I think that was one of the reasons why we were so impressed by the survey effort, is it targeted that audience and went directly there. But we do, and just to answer, we try in a number of different ways, but I think you're always trying. I feel like our system, I've been a part of our system, intimate to it since 1991, which shows my age, but we've gone through different stages. And, I'm sure like others you've had, and I'll speak to the professional pieces of it at this point. You had different times where the relationships were good. Sometimes they weren't so good. Sometimes they were really awful, depending on issues, and you've been through all that. But I think the virus has shown us that we are one family, all of us. And I've been remarkably impressed with the way that people have worked together. There's never going to be continuing unanimous agreement, but there has been a real desire to partner. There's been a real desire to work together. I think here in Ohio that has shown itself. I couldn't be more appreciative for the relationships that have been built during this environment, the way that people have tried to help one another. The people have really bellied up to the I won't say to the bar, but they bellied up and worked at it. And it's been exceptionally hard in so many ways, but people have tried. And I'm hoping that is lasting, that, whatever remaining legs of the journey we have with this virus environment as we move our way out of it, I hope what sustains is the fact that we know we're better when everybody works together. I want to thank you, and all of the team at NASDS for, helping us put this story out there. I think it's not just a nice one because of the effort and the target, but the way that it turned out, we learned a lot. And so there's no reason that we won't do this again and again here in Ohio to see exactly, where people are, how they're feeling, and what kinds of things we need to do to adapt. So thank you very, very much.
Our final step is to my home state, Maryland, Throughout the public health emergency, many people with disabilities lost their jobs and rates higher than the general population. However, many people with disabilities continue to work as essential personnel even during the early days of the pandemic. In this segment, we will see interview conducted by former state superintendent of schools in Maryland and board chair of Kennedy Krieger, Dr. Nancy Mack. The interview was filmed in October of 2020, highlighting National Disability Employment Awareness Month and the work of people with IDD and their support staff throughout the pandemic. In this segment, we will meet Oscar Martinez, who is a customer service worker at Petco. Oscar returned to work in summer after several months of staying home due to the pandemic. We will meet Jonathan Summer, who works at Safeway. Jonathan is an essential worker and continued at his job even during the safety days of the pandemic. We will also meet Daree Day, who is a volunteer at a local nursing home. We will hear from a district support professionals, Joe Pastel, who will wrote the importance of IDD workforce during the pandemic. Then we will talk with state and provider leadership about their efforts to remote supports and their technology to support those with IDD who were essential personnel and help those who stopped working to get back to their jobs. Advocate and Maryland State employee Nicole LeBlanc will interview provider Stacy Harmon about how their partnership with Maryland Departmental Disability Administration gets stronger during this time. Let's travel to my home state, Maryland.
Thank you so much for such a gracious introduction to all of us. I am truly thrilled to celebrate the National Disability Employment Awareness Month. This is an area which has been near and dear to my heart for many, many years. So today, as you've heard, you'll hear from three outstanding individuals who will really share their work experience, especially during this COVID-19 time. They'll also speak to the individuals who support them in their work placement and in really achieving their goals in work. And so I'd like to begin, and I'm going to ask Oscar if you would share with us where you are currently working.
I work at Petco. It's close to my house.
And I'm going to ask the same question of Jonathan. Where do you work?
Hello?
Yes, Jonathan, can you tell us where you work?
I work at Safeway.
Thank you. And I'm going to ask you, Jonathan, how long you've worked there.
I worked there for about 3 years.
Okay, and Oscar, how long have you worked at Petco?
How long I've been working at Petco? Last time I started there, and I started in January 2019, and this is my second time being at Petco.
Great. And so, Devry, where were you volunteering before COVID-19?
I was volunteering at Meadow Park.
And what is Meadow Parks? Tell us.
It's a nursing and rehabilitation center where the residents, they stay there, they get therapy there, and basically what I did in the activity room, like play games, read to the residents, and just bring smiles to them, talk to them, get them interactive with certain things. That's why I would bring my music and we would listen to some of my music, and they liked it, and it was nice.
And how long were you there, Devry?
I think 3 years.
And so during this COVID-19 time, how did your workplace change so that you had to adjust to that change? Oscar, tell us about Petco and any special considerations during this COVID-19 time.
Because last time, and that was at the end of March, that's why the manager told me to stay home because because I needed to take my day off because of COVID-19. That's why I had to stay safe.
Okay, and so have you returned at this point?
I got returned on June 11th. That's why I always put on my mask and my gloves.
Good. Okay, and Jonathan, what about you at Safeway?
So at Safeway, I was keeping my mask on and had my gloves on all the time.
Let me ask you, how hard was it to adjust to the change you had to make when you found out about COVID-19? Was it difficult for you to make those changes?
Yeah, make those changes. Like if my manager told me that I had to stay home again, that because I need to stay safe.
So that was a change you had to make at one point in time.
Yep.
But now you're back.
Now I'm back now because I always do Zoom with Core Foundation. After when I took my break at work, I always call my staff that support me at Kenny Career is Steve.
Okay. And I'm going to ask Jonathan that question also. Jonathan, did you feel there had to be a major change from your employment during the COVID-19 time?
The major change would be wearing a mask and gloves because usually before COVID-19 started, I was not wearing a mask at all before COVID-19 started.
Did you have to take any time off?
Yes, I took some time off. 2 weeks. I took 2 weeks off.
And then your employer wanted you to come back again?
Yeah, they wanted me to come back again because they didn't have anybody else on duty to do carts.
So I wanted to ask you about virtual supports. Are you participating in that?
Virtual?
Supports.
Zoom. Yeah, Zoom. Yeah, Zoom. I'm participating in that.
So you are participating?
Yes.
How helpful is that?
It's good. It's helpful.
In what way is it good for you?
Keeps me alert, and I meet more people who have been a part of this, my job coach.
And Devry, I know that you're involved with Zoom because you talked with us about it. Is there anything else you'd like to say about that?
It's been very insightful and helpful to me. Now the other people that's on Zoom, they're much younger than me, so I feel they look to me to, I guess, inspire them, because I think the majority of them walk. I'm the only one in the chair. So I guess when they hear me and hear the insightful answers that I give, whatever we're looking at or talking about at the time. They cheer me on. That's a good one, Debbie. Thank you. That's good. And that pumps me up even more. So for my team, I say thank you to my participants that are on with me. And it's insightful to me because it keeps my brain active, keeps me going. You know, it's a motivator. That's the best way I can put it.
They're needed more than ever. This is one of the biggest outcomes that I've seen. Like the guys at the grocery store, they're working more hours than they used to. The other positive outcome I've seen is that, you know, like I said before, people are more comfortable with technology, which is, you know, where there's a lot of conversation about using adaptive technology, and that's going to be come another big thing in the future. And COVID-19 is the perfect time to learn it.
Stacy, can you share what flexibilities under Appendix K your agency has used?
Thank you for having me at the NASES conference. I'm really excited to be here. So under the Appendix K, through the Maryland Developmental Disabilities Core Foundations at Kennedy Krieger Institute has been able to use the modified service hours. So instead of having to do 6 hours of service, we've been able to implement anywhere from 1 hour to 6 hours a day for each individual we support. We've also been able to use the remote services option. So getting to connect with our community members through virtual platforms, just like we're doing right now. We've also been able to focus with flexibility on staffing, allowing the ratio flexibilities along with different ways of hiring, different ways to implement our training. So we are really thankful for the Appendix K and grateful to the Maryland Developmental Disabilities for all of their guidance during COVID-19 and providing supports and strategies to implement the Appendix K modifications.
How has this supported the people your agency supports and their families?
Yeah, so the flexibilities from the Appendix K has really been able to keep our community connected. Not only our core foundations at Kennedy Krieger Institute community, but providers across the entire state. The silver lining in COVID is that these flexibilities have allowed for agencies to connect and the community members, the people we support in our programs to connect as well, making our community larger, especially across the state of Maryland, where we are separated by regions. During COVID, we've been able to connect all of our regions working collaboratively. Our families are extremely appreciative of the opportunity for virtual services and also the guidance on being able to re-enter our community that was provided from the Maryland Developmental Disabilities. The continued support and guidance from the state has allowed our communities to feel safe, secure, and they know that we are doing our very best to keep everyone healthy. But most importantly, it is connecting our communities and keeping us connected during the pandemic.
What do you think DDA has done that has assisted your agency during this COVID state of emergency?
Yeah, I can't thank the Maryland Developmental Disabilities Administration for all of their support during the pandemic. It started early on with weekly Friday calls with all the provider agencies, families, individuals supported through the developmental disabilities, where our Deputy Secretary, Bernie Simons, has been available to us week by week, sharing updates along with many others who work within the Maryland Developmental Disabilities. Now we've continued those calls, which are bi-weekly, which I think the providers really appreciate how much opportunity we're getting to learn about updates, changes, whether it's Appendix K or also just changes in general with service delivery. And that has really been a benefit to the provider agencies, the families, and the individuals supported through the developmental disabilities. Not only are we having bi-weekly now meetings, but we've also developed working groups. So the Maryland Developmental Disabilities has reentry groups in the different regions that allow providers to give input in support of reentry plans, resource sharing, and continuing that collaboration. I know I mentioned this before, but really a silver lining in all of this is increased collaboration across the state that's been guided by the Maryland Developmental Disabilities. They've also designed at-a-glance documents, which have been extremely helpful when we're trying to provide guidance for myself as the director of core foundations at Kennedy Krieger Institute, but also for my staff to understand the changes through Appendix K, the changes into her service delivery, the modifications. So these at-a-glance documents are so useful and great tools for staff training and also for myself. They also designed a question and answer document. So they were, of course, being bombarded with question after question. They took so much time, the Maryland Developmental Disabilities, to continue to answer our questions and then update that document on a regular basis. We've continued to get regular memos, regular communication. Our regional directors have been extremely responsive, and they also adapted a way for us during this process for modifications to service plans and where we deliver services. So they streamline a process to simplify it for the providers to ensure that services were able to be implemented in an expedited amount of time to continue to provide the supports for each individual that's served by the developmental disabilities in Maryland.
What has been the most challenging, rewarding, or silver lining of this pandemic to providers?
Yeah, I definitely think it's been the collaboration across the state of Maryland. I have always collaborated since we started, became an agency at Core Foundations at Kennedy Krieger Institute, but I've never collaborated as much as I have with the number of agencies across the regions. So we on Central Regional in Maryland, we are collaborating with someone in Eastern Region, which is 3 hours away. And that is something that I think is such a silver lining to share our practices. I also think the weekly, which turned bi-weekly calls with our Maryland Developmental Disabilities Deputy Secretary, Bernie Simons, has been such a huge benefit to the providers. And again, a silver lining to get updates on a regular basis, to connect, to ask questions. It's so important that we work together to serve the population in the state of Maryland with disabilities, to ensure that they're having meaningful opportunities, accessing their community, and having meaningful employment in their community. I also think remote services is really a silver lining. The access that it allows for individuals to connect and communicate during the pandemic, which can continue after the pandemic. At Core Foundations at Kennedy Krieger Institute, we always use FaceTime and Skype as a way to connect with those in employment as a check-in in the event we weren't on site that day, when they're in full-time paid employment. And we really saw the benefit. So it's great to see this practice being utilized across the state to support employment, but also to support connecting our communities. One of the areas that we've also grown collaboration is our project search programs in the state of Maryland. We've actually been able to utilize this platform of virtual remote services so that our project search programs can focus on practicing job development skills together. Programs are collaborating and connecting. Our interns in our programs are getting the opportunity to greet and meet and access so many of the opportunities between the programs, which is even enhancing their programs. So again, silver lining is the connectivity and creating meaningful opportunities through a virtual world.
Thank you, Stacy, for your leadership and commitment and the great work you are doing.
Thank you for having me. It was wonderful to speak with you, Nicole.
See you in our next show.
Absolutely. I can't wait.
Bye.
See you later.
For the past 7 months, the Maryland Developmental Disabilities Administration has ensured a two-way communication with our families, our advocates, our providers, and the community during this public health emergency. We've been conducting bi-weekly webcasts with up-to-the-minute information, created a dedicated COVID-19 webpage with information, tools, and resources for our providers, individuals, families. In addition, we've created an at-a-glance, one-page document as a quick reference so that people don't have to read through all of the Appendix K that we got approved by the Center for Medicare and Medicaid Services. And so we also have had webcasts for parents. And that has been led by a parent that basically is dealing with the critical information as related to COVID and our DDA supports that are available for them. We've been fortunate to partner with an epidemiologist from the Maryland Department of Health that has been providing information and resources to our stakeholders during our webcast and assisted us in strengthening our communication and relationship with the various local health departments in reference to outbreaks, testing, and resources for DDA providers. Our stakeholder community has been resilient, creative, and extremely involved with us during this difficult time. Together, we've learned to find ways that we can provide services that I think have been positive and will continue post-public health emergency. For an example, there has been a lot of feedback about how positive the remote virtual supports have been, the use of assistive technology, and in providing meaningful day services in the community instead of in a building. So on behalf of the DD administration, I want to take this opportunity to thank our state providers, our advocates, our families, our direct support professionals, and my DDA staff, and all the partners who have joined with us to provide a safe and effective support during this incredible time of stress. This has been like no other time in history. However, our community and providers and families and individuals all pulled together to meet this need at this moment, and I am incredibly proud of all of the work and the tireless hours and sacrifices that the DDA mission to support people with intellectual and developmental disabilities in this state, and has been instrumental in weathering this time of the pandemic. As Stacy said earlier, noted that there's a silver lining in everything, and there was increased collaboration, was truly something to be treasured. At DDA, we are and will forge ahead with deeper connections, a new understanding of our capabilities, and an eye towards all that is possible in our state. Thank you for the opportunity to share our COVID story with you.
This concludes our story tonight, but the COVID story continues on. We want to thank the advocates, families, DSPs, providers, state leaders, and others who have worked hard during this time. We are also very grateful for those who opened up their lives and told their stories to us to share this evening. Your story is our story. Thank you for joining us.